I'm Nurse Mia and your host, and today we're studying a critical topic, coordinating care for patients with hepatic disorders.
Med-Surg chapters are about 50 pages long, and half of the time you can tell what is important. Before we get into the details, I always like to zoom out first to look at the big picture of the chapter. I use a concept map like these to break it down heavy chapters. Hi everyone, and welcome back to the NurseGetsZen study group. I'm Nurse Mia and I'm your host for today. We are diving deep into this critical topic, coordinating care for patients with hepatic disorders. This is chapter 59 in our textbook, Davis Advantage Med-Surg 3rd edition, and we'll go section by section to ensure you have all the necessary information. Use the timestamp for your interested disorders. Grab your notes, get comfortable, and let's get started. Get your coffee. I got my coffee. So the introduction of hepatic disorders, we'll talk a little bit about it, and then the hepatitis, we have the epidemiology, patho, signs and symptoms, the type of viral hepatitis. Here are they. We have also acute versus chronic, and medical management and nursing management. And each disorders, they have the same. So it's like having a concept map from all of them. So I will have some pictures and my notes, and you can show the screen and you have it for later to review. I hope you like this video. I use the PowerPoint, and then I use also this is from Xmind. I got a Friday Black Friday coupon, so it's worth it, and it helped me faster. Before I had to type one by one. Now I just make it easier, simple. So let's get started. Introduction to hepatic disorders. So first up, let's set the stage by understanding the star of the show, the liver. A liver function in anatomy, the liver is one of the largest and the most complex organs in your body. It's located in the upper right quadrant of the abdomen, nestled right under the diagram. Its blood supply is unique. It receives blood from two main sources. The hepatic portal vein carries nutrient-rich blood from the gastrointestinal tract, while the hepatic artery supplies oxygenated blood from the heart. This amazing organ has so many jobs. It's a key player in a blood storage and filtration. It's responsible for bile production to help with digestion. It synthesizes crucial chlorine factors, and it's a metabolic powerhouse that manage detoxification of substances like drugs and alcohol. It also stores vital vitamin and iron. B, hepatic dysfunction. So what happens when things go wrong? Hepatic dysfunction is simply the liver's inability to perform its usual function. It can be caused by a range of issues, from viral infections like hepatitis to conditions like cirrhosis, liver trauma, or even liver cancer. So C, number 3, healthy people 2030. initiatives and what are we doing about it as a nation. The Healthy People 2030 initiatives put a big focus on preventing those disorders through healthy lifestyle, education, and vaccination. The specific goals includes decreasing the rates of hepatitis A, B, and C, and reducing the numbers of deaths related to cirrhosis. Since we're in the introduction and it's a little bit talks also about anatomy and physiology, so here is the anatomy, the key terms. I talked earlier in the previous video, part 1, the key terms. This is the picture from there. The hepatocytes is the liver cells. So this is the liver and here is the loop. This looks my notes. This is a short screen from my notes regarding introduction to hepatic disorders. So I said, see the Healthy People 2030 initiatives, the hepatic dysfunction and liver function in anatomy when I was talking about that cell. And I think it's nice to have as a flashcard. Hepatitis. Now we talk about one of the most common hepatic disorders, hepatitis. The epidemiology, hepatitis is a global issue. Its incidence and risk factor vary, but we see a lot of transmissions via the fecal oral route or throughout contact with blood and bloody fluids. Specific risk factors can include chronic alcohol use, certain medication like statins and acetylcholine, Tylenol, and exposure to toxins. There is also autoimmune hepatitis, which comes in two types and occurs when the body's immune system attacks its own liver cell. Globally, hepatitis is like the 7th leading cause of death, with a high prevalence of chronic hepatitis B and C. That's why prevention, especially through vaccination for HIV and HBV, it's so important. Next is the pathophysiology. At its core, hepatitis is an inflammation of the liver cells. This inflammation impairs the liver's ability to perform its core function like detoxification, protein production, and storing nutrients. The mode of transmission depends on the specific virus, but it's typically through contact with blood and bloody fluids or the fecal oral route. We classify those viruses as A, B, C, D, E, and G. And they all have different incubation period and transmission methods. Clinical manifestation. What does hepatitis look like in a patient? Common signs include abdominal pain, skin itching or pruritus, jaundice, malaise, fever, nausea, and vomiting. When we look at lab results, we'll see some key abnormalities: elevated ACT and ALT, which are liver enzymes, elevated bilirubin, elevated serum ammonia, and decreased albumin. Jaundice and pruritus are particularly important signs. For these key terms, you can go to part 1 and you can see pictures there with those key terms. They occur because those signs, they occur because of the accumulation of bilirubin and bile salts in the body, which the damaged liver can no longer process. In some severe cases, patients can develop fulminant viral hepatitis, which is a life-threatening form of acute liver failure. This is a medical emergency with symptoms like neurological decline, GI bleeding, coagulation disorders, and ascites, which is fluid accumulation in the abdomen. Types of viral hepatitis. Let's quickly go over the different types of viral hepatitis. So hepatitis A, which we call HAV, this is transmitted via this. This is transmitted via fecal-oral route, often through contaminated food, water, or shellfish. It's an acute self-limiting infection that is usually mild or even asymptomatic. Diagnostic is made by detecting the presence of IgM and anti-HAV. The second, we have hepatitis B. This is a much more serious infection transmitted to blood and body fluids like semen. It can be acute or chronic, and thankfully we have a vaccine for it, right? Especially in the nursing school prior enrollment, it's asked kind of mandatory to have these 3 series of vaccine. And risk factors include sexual contact, IV drug use, and hemodialysis. What else? So risks include sexual contact, IV drug use. So chronic HBV, it's a major concern because it can lead to cirrhosis and liver cancer. For hepatitis C, is transmitted to blood and bloody fluids, has a high rate of becoming chronic. There is no vaccine, and it is the most common reason for liver transplant in the United States. Risk factors are used for HBV, including IV drug use and needle stick. The hepatitis D, this one is a bit different because it can only be transmitted in patients who already have hepatitis HBV infection. So hepatitis E, like HIV, so the hepatitis A, this is transmitted via the fecal-oral route, the contaminated water, and it's very rare in the United States. For non-viral hepatitis, it's important to remember that not all hepatitis is caused by a virus. Non-viral hepatitis can be caused by exposure to toxin or medication that are ingested, inhaled, or injected. It presents with similar symptoms to viral hepatitis, and recovery depends on removing the toxin substance. Acute versus chronic hepatitis. Finally, we classify hepatitis as either acute or chronic. For acute hepatitis, lasts less than 6 months and usually results in a full recovery. Chronic hepatitis lasts longer than 6 months and significantly increases the risk for cirrhosis, liver failure, or liver cancer. Here it's my flashcard that I just talked about hepatitis, the epidemiology, clinical manifestation, and the types. Non-viral hepatitis, acute versus chronic. Interprofessional management. So how we do manage those patients. It takes a whole team. Medical management, first for diagnostic, we use a battery of lab tests like AST, ALT, GDT, alkaline, phosphatase, serum albumin, and bilirubin, to name a few. Those tests help us determine the extent of liver damage. In terms of medication, there are antivirals to suppress viral replication, and for HAV, so the hepatitis A, we have used post exposure prophylaxis with immunoglobulin or a vaccine. Of course, vaccines for hepatitis A and B is a key preventive measure. Diet and activity are also crucial. We encourage a low-fat diet, high in fruits, vegetables, and whole grains, and suggest small frequent meals. Patient should avoid alcohol and hepatotoxic medication and balance rest and low impact exercise to fight fatigue. For surgical management, sometimes surgery is needed. The liver transplantation is most commonly indicated for patients with hepatitis C related cirrhosis. This can be an orthotopic transplant from a cadaver donor or a living donor transplant. The main complication we need to watch out for are organ rejection and infection. Patients will need to take immunosuppression medication like cyclosporine and tacrolimus for the rest of their life. Nursing management. As nurses, our role is essential. Assessment, and we will be looking for common findings like elevated temperature, jaundice, fatigue, decreased appetite. We'll monitor vital signs, labs value, and the color of the patient's skin and the sclera. We also need to keep track of nutritional intake, daily weight, and intake and output. Nursing diagnostic, based on our assessment, we might use diagnosis like activity intolerance, acute pain, altered nutrition, altered through process due to elevated ammonia or to acknowledge deficit. Nursing intervention, our action include administering medication and antiemetics, providing those small frequent meals, and promoting a balance between rest and activity. Our teaching is just as important. We will educate patients on nutritional guidance, good hand hygiene, avoiding risk behaviors like needle sharing and unprotected sex, and the importance of vaccination. Evaluating care outcome. Ultimately, we want to see stable vitals and weights, a decreased LFT values, and the patient demonstrating an understanding of their disease and making positive life changes. Moving on, let's talk about cirrhosis. This is often the end stage of chronic liver disease. Epidemiology and risk factors. So cirrhosis is the third common cause of death for people between the ages of 45 and 65. It's more common in males and black and in impoverished population. The most common cause are hepatitis C and chronic alcohol use. Genetic connection may affect who is susceptible, and risk factors include chronic hepatitis, alcohol use, biliary disease, and conditions like non-alcoholic steatohepatitis or NASH, which is a fat accumulation in the liver often seen in obese patients. Prevention is about improving health habits, avoiding risky behaviors, refraining from alcohol, and getting vaccinated for hepatitis. Types of cirrhosis, we see different types of cirrhosis based on the cause. Alcohol-induced cirrhosis, the second most common form, caused by chronic alcohol use and malnutrition. Post-necrotic cirrhosis caused by scar tissue from a previous viral hepatitis or hepatotoxin. Biliary cirrhosis, scarring around the bile ducts, leading to severe pruritus. Non-alcoholic steatohepatitis, as we said, this is fat accumulation in the liver. Genetic causes like Wilson's disease, copper accumulation, or hemochromatosis, iron overload. Autoimmune cirrhosis caused by an abnormal immune response. Cardiac cirrhosis caused by a decreased oxygenation of liver cells due to severe right-sided heart failure. So the pathophysiology, the core process of cirrhosis is chronic cell destruction and fibrosis or scarring of the liver tissue. Functional liver cells are replaced by nodules surrounded by this fibrous tissue, which can perform the liver's normal function. This leads to some major alteration. Portal hypertension, this is an increase in pressure in the veins carrying blood to the liver. Shorting of the blood bypass the liver, leading to enlarged veins or varices in the esophagus and stomach, and hemorrhoid. Ascites, an accumulation of protein-rich fluid in the abdominal cavity, often leading to pleural effusions. Coagulopathy, the liver can synthesize clotting factor, leading to prolonged bleeding and a low platelet count. Hepatic encephalopathy, this is a disturbance in the central nervous system because of buildup of toxin, mainly ammonia, in the blood. This can range from mild confusion to a coma. For clinical manifestation, patients with cirrhosis might present with a variety of symptoms including short of breath, jaundice, increased abdominal crease, and abdominal pain. You will often see an enlarged spleen, an increased risk of bleeding, and elevated liver enzyme. For patients with hepatic encephalopathy, you might notice changes in their level of conscience. A flapping hand, tremor called ascites, and a sweet fecal smell on their breath called factor hepaticus. Here is just what I said, but in a flashcard and bullet points in case you like this way. Just take a short screen and later you can print out or just review from your device. I just said for clinical manifestation. Now we're in medical management. For diagnosis, we can use non-invasive tests like ultrasound and CT scan, and sometimes minimally invasive procedure like an EGD for varices. The most invasive test is a liver biopsy, which is a key diagnostic tool. Safety alert here: after liver biopsy, always monitor for bleeding and hypotension. Treatment for ascites includes sodium restriction and diuretics. For portal hypertension, we can use medication and endoscopy procedure to manage the varices. For hepatic encephalopathy, we restrict protein intake and we use medication like neomycin and lactulose to excrete the excess ammonia. Surgical management: the surgical option for reducing portal pressure is the transjugular intrahepatic portosystemic shunt. The only long-term option for advanced cirrhosis and hepatorenal syndrome. It's a liver transplantation. Complication: we need to watch for several complications: hyponatremia, a low serum sodium level due to impaired kidney function; hepatorenal syndrome, a rapid deterioration of kidney function with a very high mortality rate; spontaneous bacterial peritonitis, an infection of the acidic fluid. For nursing management, assessment will monitor vital signs, respiratory status, abdominal crease, and for any signs of bleeding. We also track intake and output and daily weight. Nursing diagnosis: we might use diagnosis like fluid intake, excess deficit, altered nutrition or risk for injury from bleeding or falls. Nursing intervention: our action include administering diuretics, restricting sodium and fluid intake, elevating the head of the bed, and administering vitamin K or bleeding or blood products for coagulopathy. Our teaching focus on the disease process, dietary restriction, and lifestyle changes like avoiding alcohol. We also educate on bleeding precaution like using a soft toothbrush or electric razor. Next, let's talk about liver cancer, a very serious condition. Epidemiology, the incidence of liver cancer has been rising dramatically. It's the third most frequent cause of cancer mortality and can often spread to the liver from other organs, most commonly the colon. American Indians and Alaska Native have the highest incidence rate. Pathophysiology, the most common type of primary liver cancer, is hepatocellular carcinoma or HCC. The primary driver is chronic inflammation of the liver, which often leads to cirrhosis and then to cancer. Other risk factors include chronic hepatitis B or C, heavy alcohol consumption, and obesity leading to NASH. The prognosis is often poor because it's usually asymptomatic until the later stages, but early diagnosis can allow for aggressive treatment. Clinical manifestation early on is often asymptomatic. Common symptoms in late stages include abdominal pain in the right upper quadrant, weight loss, fatigue, jaundice, and ascites. So here we have the types of cancer, primary and secondary. This is the flashcard of liver cancer for epidemiology, pathophysiology, clinical manifestation. This segment of the part of disease, we have medical management for high-risk patients. We do routine screening every 6 to 12 months with imaging and blood tests for alpha fetoprotein. We use imaging like ultrasound and CT scan for diagnosis and liver biopsy to determine the type and stage of cancer. Treatment for liver cancer can be tricky. Systemic chemotherapy is generally not effective. Instead, we use target therapies like selective internal radiation therapy, which delivers radiation directly to the tumor. We also use ablation therapies like radiofrequency ablation to hit and kill tumor cells. Prevention is the key here. The hepatitis B vaccine can help prevent liver cancer by preventing the infection that often leads to it. The surgical management, surgery can be an option. A partial hepatectomy can remove the tumor if it's small and the liver function is normal. A liver transplantation is an option for patients with small early stage tumor. For metastatic disease, surgery is usually palliative or palliative to relieve symptoms. Nursing management, the assessment, we will assess for pain, short of breath, monitor for abdominal grief daily. We also monitor for jaundice, weight loss, and lab values. Nursing diagnosis here, it's common diagnosis like include pain, activity intolerance, risk for ineffective coping. Nursing intervention for liver cancer. Our action include administering pain medication, antibiotics, and antipyretics. We will apply elastic wraps for edema and restrict fluid, sodium, and protein intake as ordered. Our teaching focus on diet and exercise, pain management, and providing information on diagnostic tests. The evaluating care outcome depend on the stage of the cancer, but our goal are pain control, managing fluid retention, and ensuring adequate nutritional intake. We also focus on supporting the patient and family, especially when the disease progresses to the end of life care. Here we have the flashcard, and I hope these bullet points help you to go faster through the chapter. Finally, let's talk about liver trauma, epidemiology. The liver, it's a large vascular organ which makes it the most commonly injured organ in the abdomen after the spleen. It's often injured in a blunt trauma like motor vehicle accidents, but also in penetrating trauma from gunshot or stab wounds. The most common cause of death is hemorrhage, and there is a high risk of other concomitant injuries. The pathophysiology, the outcome depends on the severity of the injury, age, and existing shock. The liver's high vascularity means any trauma increases the risk of massive bleeding. Clinical manifestation, we look for the signs of hemorrhage and shock, decreased blood pressure, tachycardia, and pallor. In the abdomen, we'll see pain, guarding, and distension. And then now we go for the bullet points. Here it's the concept of liver trauma, and make sure you know the signs of hemorrhage and shock and abdominal signs. For medical management, an abdominal CT scan is the primary diagnostic test, and it has reduced the need for exploratory surgery. Most injuries are managed conservatively with fluid resuscitation, blood transfusion, and close monitoring for shock. Patients are put on bed rest initially and told to avoid strenuous activity for up to 6 weeks to allow the liver to heal. For surgical management, surgery is used to control excessive bleeding or bile leaks. Procedure can range from suturing the injury to a partial removal of the liver tissue. Complications. Immediate complications are hemorrhagic or hypovolemic shock. Later complications can include abscesses, peritonitis, and sepsis. Long term, there can be impaired albumin synthesis and blood coagulation. For nursing management assessment, we will monitor for signs of shock, check for pain and guarding in the right upper quadrant, and measure abdominal grief daily. We will also watch serial hemoglobin and hematocrit, and access for decreased urine output, which can be a sign of hypovolemia. Nursing intervention will administer fluid resuscitation and blood products, give antibiotics to prevent infection, and enforce activity restriction. Our teaching will focus on the purpose of diagnostic test and the importance of those activity restriction to allow for healing. So make sure you educate the patient the purpose and of the diagnosis studies. Stress the importance of activity restriction, advise the patient to take prescribed vitamin and iron supplement, and here with iron supplement has to drink vitamin C or orange juice. Teach patient to recognize and report signs of complication as increased pain. This picture is from the key terms video, the part 1. So this is the surgery, the transjugular intrahepatic portosystemic shunt, a surgical procedure to place that shunt, the tube between the portal and systemic veins to reduce pressure and fluid build up the ascites. So see, when you understand the liver's job as a filter, those big terms start to make a lot of sense, right? Let's recap. So chapter 59, hepatic disorder summary. I hope you like these pictures that shows for our liver disorders like hepatitis, liver cancer, primary, secondary, liver trauma, and cirrhosis. I think Gemini made a beautiful picture. I like this picture a lot. So the chapter summary, the liver serves several functions, including blood storage, blood filtration, blood production of bile, synthesis of clotting factor, prothrombin, and factor 2, 7, 9, and 10. And metabolism of carbohydrates, fat, and protein. The liver also serves to detoxify the blood, and it's a storage area for vitamins A, D, E, and K, and iron. Hepatic dysfunction occurs when the liver is no longer able to perform its usual functions. Several conditions such as hepatitis, cirrhosis, liver trauma, and liver cancer all impair the ability to the liver to perform its routine function. Hepatitis is an inflammation of liver cells, most commonly caused by a virus that limits the ability of the liver to detoxify substances, limits the production of protein and clotting factors, and alters the ability to store vitamins, fats, and sugar. Modes of transmission of viral hepatitis include contact with blood, blood products, semen, saliva, and mucous membrane, direct contact with infected fluids or objects, or through the fecal route with contaminated water or food. Patients with hepatitis can have a mild or severe illness, which can be acute or chronic. The virus of hepatitis are classified according to letter ranging from A to G. Each of Each differs in incubation period, mode of transmission, and other characteristics. The most common hepatitis virus are hepatitis A, B, and C. Next, the cirrhosis of the liver is a chronic disease that causes cell dysfunction and fibrosis or scarring of hepatic tissue. Functional liver cells die and damaged liver cells regenerate into nodules of liver cells, which are surrounded by fibrosis tissue. This irreversible chronic injury to functional liver cells results in liver cell necrosis and altered liver structure and function, leading to alteration in blood and lymph flow, resulting in hepatic insufficiency and hypertension in the portal vein. Alteration of blood flow to the liver results in portal hypertension and shutting of blood around the liver that leads to increased pressure in the surrounding vessel and esophageal and gastric varices, which may result in the upper GI bleeding. So cirrhosis is generally irreversible and treatment generally focused on preventing progression and complication. In advanced stages of cirrhosis, the only option is a liver transplant. Liver cancer, it's classified as either primary or secondary. Primary liver cancer, hepatocellular carcinoma, originate from the liver, and secondary liver cancer originate from the other areas of the body and metastasis to the liver. So here, this secondary means that somebody has cancer, let's say skin or other organ, and spreads through to the whole body. So risk factors for primary liver cancer include diseases that cause long-term inflammation of the liver, including chronic infection with hepatitis B or C, or several year history of heavy drinking, defined or more than 2 alcoholic drinks a day for several years. Other risk factors include autoimmune disorders, hemochromatosis, obesity, and the history of diabetes, or as a byproduct of mold found in certain foods. The prognosis for patients with liver cancer depends on the age of patient, the stage of cancer, and whether or not is a primary or secondary liver cancer. Once the patient has been diagnosed, the course of treatment is determined for either cure if diagnosed early in the disease, or treatment of the symptoms if more advanced and considered incurable. Liver trauma is a result of injury to the liver via either blunt or penetrating trauma. The right lobe of the liver is more susceptible to injury than the left lobe because of its proximity to the ribs. In trauma, injuries to the liver can include laceration, concussion, hematomas, bile leaks, and bleeding, and it is important to serially monitor a patient with trauma to the abdomen for liver damage, which may not occur immediately after the traumatic event. Close abdominal assessment, serial hemoglobin and hematocrit values, and frequent hemodynamic monitoring are important. patient can recover well from injury with prompt intervention. It is important to monitor for concomitant complications such as alteration, atelectasis, oh my goodness, pneumonia and abscesses formation. And that wraps up our deep dive into chapter 59. I know that's a lot and a lot of information, but breaking down, you can really start to see how all those concepts are connected. You're doing great. Me, hard to pronounce those terms, so that's why I like to show on the screen the flashcard and everything. In case I mispronounce, you will know. You just put me on mute and show screen and you study better. So thank you for watching to the end. I will see you in the quiz practice for NCLEX style, and I have there a nice case study, more picture, and practice of 15 domains of NCLEX, and case study with 6 questions. It's really interesting. So see you there. Bye for now.